natural methods of birth control, which a lot of people still practice, which is the calendar method, where you mark your fertile days on a calendar and you don't have sex on those certain days, or you measure your basal body temperature, or you practice pulling out, or you practice abstinence. And so, again, depending on your religious affiliation and your personal choices, I think that these can work. But when talking about the effectiveness, the condom is still about like maybe the most effective because of the way that it's designed. But when you talk about all types of contraception, there are, when we think about the percentages, like, oh, 95%, 97%, 85%, what we're really talking about is perfect use and typical use. So if someone uses a contraception perfectly every single day, it's more effective. But given that we're all humans and we make mistakes, it's typical use, right? And so accounting for that margin of error, I don't know the numbers right off the top of my head right now, but there are methods like the barrier methods, the condoms, even like oral contraceptive pills that are really effective, or the IUD. And there is still a small margin of error where, many people who have used these contraceptions can get pregnant. But when you think about pulling out, when you think about, the pulling out of the withdrawal method, you think about the calendar method, those are definitely like 50-50, right? You're really just taking a risk and it may or may not work for you. So those are maybe not as effective as really thinking about other more, scientifically proven methods like the pills or, condoms. Have a fun exercise for you guys where you can sit at a table with your partner. And what I want you to do is write down a list of all the contraception that you think you are fit your lifestyle. And then on another sheet of paper, you want to write the contraception that is absolutely a no-go. And giving myself as an example, with my husband, we realized that the condoms, the male condoms, and the IUD are something that we're totally okay with. And something that's a no-go is the oral contraceptive pills, because they didn't work for me in the past. I don't want an implant in my hand, in my arm. I don't want the Depot injection because I have to book an appointment to go to the doctor every 3 months. Do we have a car? Can I fix that appointment? How long is the doctor's office? And so you really want to think about, cost. You want to think about like accessibility, and you want to think about how often you need to continue using it. And one thing that I also really advocate for is contraception can often be placed on women, right? On vulva owners. Like it's often our responsibility. It's our responsibility to figure it out, which one is the best for us, to go to the doctor, figure out those doctor's checkups, to pay for it, to deal with the side effects, to deal with the after effects. And so, finding something that both partners can play, somewhat of an equal role in. And so, in the beginning, we were only using condoms as contraception, and it's up to you to use it correctly, so that, we can prevent pregnancies and, prevent STIs, obviously. But really thinking about like equity should also come into play, right? So if you are, on that piece of paper, you've written what works for you and what doesn't work for you, thinking about the list of contraception that works for you, I want you to think about how much it costs, how accessible it is, and, how it's going to play out in your relationship, right? Is it something that when you go for the IUD, you're probably going to have a lot of cramping and you're going to have a lot of bleeding after, and it's going to take a little getting used to. So having your partner take care of you, take care of the dog, maybe they can do something for you. And so really putting those elements into it can really help both of you make the best decision for you.